to create it was actually a request of the NHS. So that's super cool. But my whole vision regarding yoga's integration in the NHS was based on yoga changing my own life. I've been very public about having mental health issues and wanting to share it with others. And I think that yoga has remained for quite a while, at least in the Western world, something of privileged people. And I feel that that really is quite sad. And I felt that integrating it into the health system, as yoga has so many health benefits, mental and physical, would be essential for other people to benefit in the same way.
It was really important to us to have a robust evidence base when we were having our conversations with the NHS. And the Westminster study of 300 patients going through the Yoga for Health program provided that. So what we see in the study's findings is that across the board, all the measures, such things like stress and anxiety levels and patient activation, all moved significantly in the right direction, and those improvements were sustained 3 months later. So that has provided a really convincing and authoritative evidence for the efficacy of Yoga for Health. And we've been able to share that, and it's freely downloadable if anyone wants to read the full study to really see how Yoga for Health works.
It's really interesting because we have this beautiful ancient tradition, thousands of years old, that purports to have particular effects. And in many cases, we see those effects arising in clinical reports. But I do think it's important to be able to tease out the difference between somebody's perception and what we can actually measure to understand clearly effects if we're going to use it as an intervention. Not to mention that I believe that with that clarity, understanding the physiological correlates of yoga, we can even enhance what we offer. So for example, in the Yoga for Health program, we teach coherent breathing, which quote unquote isn't technically a pranayama, but there is a lot of evidence around it. It is a breathing practice. And so we can share it with individuals having a sense of certainty that they're going to benefit from its practice. And we can clearly describe to NHS providers why it's beneficial so that there isn't skepticism, which is naturally there in a biomedical paradigm around things that might be more mind-body based.
It's really a different thing for yoga teachers to get used to when we train experienced yoga teachers to deliver the Yoga for Health protocol, that they have to become social prescribing, yoga social prescribing champions in their own community. And this means they're going to be connecting with and talking to the social prescribing link workers, sometimes known as community navigators or community connectors. And these are the people who are sent patients by the GP, by the doctors, or by other healthcare professionals who have problems or issues that aren't principally medically based. So they might be socially based, might be socially isolated, might be suffering from stress and anxiety. They may have lifestyle issues, a lack of physical activity, all these kind of things that fit in with our referral criteria. And they really need to get their life back on track, and they need the support to do that. And it's those social prescribing link workers that we liaise with who provide the patients, either by signposting or by formal referral, or giving them a leaflet, and the patient gets in contact with our teachers directly.
Now, the NHS wanted these 5 different populations: people with prediabetes at risk of having a cardiac event in the next 10 years, mild depression and anxiety and social isolation under one umbrella, because it's such a common presentation, all of these different things. And I felt when I was designing certain aspects of the program that they could duly benefit, because in each one of these cases, there is dysregulation in the autonomic nervous system. And so we could devise an intervention that was focused first and foremost on bringing down sympathetic activity, or that kind of fight and flight activity, to allow for a sense of calmness, which also has an impact actually on inflammation, really relevant in the diabetes. Now we understand as well in depression and of course the cardiovascular disease. And then later on, we could lead to, or we could integrate things into the program like the coherent breathing that I mentioned that support not just a downgrading of hyperactivity of the sympathetic system, but a overall balance between the parasympathetic and sympathetic system, which is essential for psychological and also physiological resiliency, whether you're talking about depression or you're talking about heart disease. It's probably going to take us 10 years. We're already making inroads. I think social prescribing in the UK puts us in a unique position to do that, definitely. And so we're seeing it. But for me to say yoga in the NHS means that there is an overall appreciation for its benefit, and services are looking for yoga teachers throughout. You know, you have this in surgeries and hospitals because they understand that yoga teachers and yoga therapists are vital as part of an integrative team. And that requires more evidence. It requires a change in perception, and it also requires us to move past the current pandemic. And I think in the next 5 years, we'll be able to say the UK is one of the leading nations still in integrating yoga into our health services, and we've made huge strides that maybe we can't even imagine right now. But in terms of full-fledged integration, I think 10 years is a more realistic time frame.